What we're going to do is give you a quick overview of what we've done to respond to the city, the emphasis that we're putting on city services in the community, and also support staff and how we're tying those together. Most of this is not new. In fact, I did a similar presentation via video after last week's council session. So again, feel free to take notes and ask questions afterwards, but I'm going to try to get through this presentation first. We are still following the lead of the county, state, and federal guidelines and responding to this. And by that, what we mean is we're trying to make sure that what we do as a city aligns with both our county, regional, and state partners, and we're counting on them to align their responses with the federal response. We feel right now, given the uncertainty of everything we're dealing with, and that's the best strategy to give us some consistent response and a little bit of messaging that people can count on, and also how we can support the services for the community with a little bit of consistency and preparedness. This is really hard to strategize, to forecast out. We're seeing changes, and we have seen changes in the last couple of weeks, not just day by day, but sometimes multiple times within the day. So we're trying to be as thoughtful and measured as we can. And that's why we're sticking with those guidelines. We get a lot of questions from some of the community members as to why aren't we doing things that they say maybe see in their where their family members are in another state or even in another community within our region. And that's because we're really trying to stay within the guidelines of those folks above us that have a little bit more info and are trying to guide it from a bigger picture. We still are on the PSD and CSU. You're all aware of the fact that they've got some suspended classes. Everybody's gone to online. We are really encouraging that limited gathering of 10 or more people, and we're applying that to our workforce. So the social distancing recommendations that everybody else that we're messaging out, we're applying that to our workforce, both in how they work in the field, how they work in the office, and we'll talk a little bit more about that, but also how they interact with the public. We're really encouraging them to politely remind the public of those social distancing guidelines. You've seen the recommendations for the business closures, the impact of the food service, restricted carryout, delivery, drive up. We're from time to time getting reports of people perceiving that maybe some of those businesses are not participating in that order that's come from the governor, but that generally has not been the case. Even when we've had employees stop by, it's not an enforcement action. We're just stopping by to check in. And what we found is that by and large, actually, I know of no businesses that are not complying with that right now. If you saw the governor's recommendation on Sunday, you'd like to reduce in-person workforces with exceptions, because there are some critical services to the economy, to the community, to the state, but with exceptions. He'd like to reduce those in-person workforces by 50%, and the city is trying to lead in that. Matter of fact, we're doing a survey right now. We think it's quite likely we're exceeding that 50% number by using non-traditional platforms of delivery of services. And again, from the beginning, we've been trying to really emphasize with our workforce, and they've been working very hard on that non-traditional delivery of services without a drop in services or minimizing the impact of services. And we feel like we're getting a pretty good grasp on that. Matter of fact, we've been talking about the fact that as much as this crisis has gripped everybody, we're finding new creative ways to, in some cases, provide service, and we're going to keep providing service in these new ways because we think the community's benefiting from it. All the city buildings are closed to the public right now. All public facing, there are some exceptions where somebody has some kind of an important or critical need. We're really trying to accommodate that, sometimes by appointment, sometimes by some other non-traditional means, where some of our stuff that we are used to doing in face-to-face, we're creating some kind of a technological platform, but generally we're doing that. We have seen transport has reduced the fares, and or actually the fares have become free right now. And again, that's to support that social distancing model, to protect our staff in those circumstances, and to make sure that the community has the opportunity to use that critical service. Or we're really being very thoughtful about supporting those critical services. And obviously transport is one of those for a lot of the community. We have had our first workforce positive case that tested positive. That employee had some minimal impact with others, but he was in 2 of our buildings. And so we did do some closure of those buildings. We did some cleaning of those buildings, and we're minimizing the ability for staff to come back and do regular operations in those buildings, other than those services which are critical to continuing core services for the community. Things we're doing for the business right now, and we talked about this a little bit last week, but we have our economic team from the city, our financial team, and our economic recovery team is working with the local businesses. We're getting a lot of calls about this, especially about the stimulus packages that are coming out of the federal government, how to apply for SBA loans, and we've got a team dedicated to that as a resource. They're working diligently to try to interpret these changing recommendations and resources available. And again, some of it is trying to get ahead of and forecasting where we see this going in the future. It's really hard right now, but they're working a ton. I get emails from them at 5 in the morning, and I get emails from them at 10 at night because they're working with many different businesses on that. We have several teams that are working with vulnerable populations. We have opened up Northside Azatlan as a shelter, both as a day shelter and a night shelter, working in conjunction with the other charities and advocacy groups, nonprofits in the region. We have become probably the number one partner for that group right now in this time by providing that space. And again, that's very much a partnership where we're providing facility some very minimal staff support that's generally in line with supporting the physical infrastructure. But those partners that provide that programming, that are good at that programming, that's their expertise, they're really providing that outreach. We also have a volunteer program going on called the Adopt a Neighbor program that's put on through our volunteer program in the city. We're coordinating both the needs of the neighbors with neighbors who are willing to provide those services. So the examples would be, maybe we've got an elderly couple that's having a hard time getting to the store, and they have a request that somebody would pick up their groceries and deliver them. We're setting those kinds of things up. Maybe some yard care needs that are going on as we move into spring. If we have a snowstorm, we're trying to coordinate how we can make sure folks get their driveways and their sidewalks shoveled. So whatever the need is, we're trying to create a portal both for folks to request and for folks to fulfill that service who want to participate. And we've got, the community has literally popping with people who want to participate in those volunteer. We get offers, many offers all day long. Starting tomorrow, we're going to participate with regional partners. As you all know, there's been a crisis of sorts within the crisis, in that a lot of our medical personnel are struggling to have the PPE needed to support medical operations. And so there's been a call from the governor to support those personnel by donating supplies that you might have that you might not need, especially now that we're getting into this position where everybody's practicing good social distancing, not going out when they don't need to. Some of that initial rush for PPE probably was maybe a little overstated for some people, and they might have more than they need. We really need to push those supplies out to the medical folks who need it. And so tomorrow there's going to be 3 spots within the city and then multiple others along the region where we offer the opportunity for people to donate those. We are, let me back up here a little bit. We are what we're calling operating at a level 4 consequence management. When we started this, we came up with 5 different levels, and the idea was to look at the circumstances impacting city services and give the organization the ability to operate across the many different departments and platforms in a consistent manner. And so we had 5 different levels. The first being there was no impact. That's how we do business every day. The second being that we're now starting to see some impact. The final services being delivered look exactly like they normally would, but we're starting to see some maybe staffing impacts. The third and the fourth level of where we've been in the last, literally we've gone through those 2 levels in the last 2 weeks, and that is where we're seeing significant impacts, not necessarily to the final service being delivered to the community, but how that delivery is being done. So we are seeing now non-traditional platforms like working from home, working in different locations than employees were used to, staffing models whereby we stagger crews and we use some creative staffing for flexibility of shifts. Things like allowing some work crews that are critical to core services now to take equipment home that we normally wouldn't let them take home because we'd have them checking them out from their regular workplace where they'd have their morning briefings. Things like that, that all of the other sectors are doing, all the other businesses are practicing, but we're practicing them in an operation that has critical core services like police, partners with fire. We don't
Things
have
like allowing some work crews that are critical.
we don't have a railroad, but if we would, we'd be working with them also. But Transport and how Transport does their staging of buses, how they schedule, all those things, we're giving a lot of flexibility to the managers and the supervisors to figure out how to maximize that delivery of service, but in very non-traditional manners. And we've seen some pretty significant impacts and a lot of things where we're getting feedback that, hey, we're going to keep doing business like this afterwards. We think it's going to be good for the community. And we are looking for strategies right now. We're exploring supporting our working parents, including maybe some childcare, especially again for those critical services that might get called at 2 in the morning or 2 in the afternoon. And normally there would have been other folks to cover those shifts, and they're not there right now. So finally, Mayor and Council members, I just want to let you know that every day we run a daily managers meeting where we have north of 50 managers from across the city. We start the morning together at 8:30. We go through all the different issues and we look to identify issues that we can foresee coming, that we're dealing with that day. We're trying to strategize maybe even 30 days out as we continue to deal with this. But we're also collaborating because as one person raises a concern from Department A, Department M says, well, we've dealt with this and this is how we dealt with it successfully. So we're trying to cross-pollinate all that expertise. It's not always an apples to apples comparison because we have so many different services within the city that we provide. But what we are seeing here is a collaborative effort across the city that quite frankly, in this trying time, I have found pretty motivating. I've told my wife I have been at this now since we started this about 3 weeks ago, and I said I have yet to meet anybody who's been hard to work with who hasn't been willing to do whatever it takes. Not that we haven't had our days, our moments, our disagreements, we do, but we have a dedicated workforce that's really stepping up, and I think we're situated probably better or as good as any jurisdiction, certainly in the region, but maybe across the country for dealing with this as we move forward.